Treatment options available for GERD start with dietary modifications, avoiding certain foods that are triggers for an individual's reflux. Such home remedies as elevating the head of the bed, sleeping on a pillow wedge or a foam wedge. Oftentimes over-the-counter medicines are sought, such as proton pump inhibitors or histamine antagonists to try to shut down one's acid production. Usually by the time I see a patient, they're oftentimes far past those home or conservative measures and have been tried on long lengths of prescription medications and prescription remedies and perhaps still have inadequate resolution of their symptoms. Troublesome symptoms such as regurgitation of stomach contents are usually not treated by medications because regurgitation oftentimes represents an anatomic defect, and an anatomic defect usually requires an anatomic correction. Medications may squelch symptoms caused by stomach acid, but if an individual eats a bowl of chili and drinks a carbonated soda, and 30 minutes later chili and soda are refluxing back into the esophagus, prescription medications usually do nothing to stop symptoms caused by that. So we have the option of medications, and when that fails, we have surgical options. Two surgical options that are used very readily and very commonly now include the Nissen fundoplication, which involves wrapping the stomach completely around the lower end of the esophagus, or a partial wraparound called a toupee fundoplication. These two procedures are performed laparoscopically while the patient is undergoing a general anesthesia, and these are performed through laparoscopic incisions. The patient is usually observed overnight and goes home after an outpatient stay. The other commonly used surgical procedure is the TIF procedure, or transoral incisionless fundoplication, and as the name implies, requires no incisions to be made on the body. It still is surgery in that it requires a general anesthesia. It also requires the patient to have complete relaxation during the procedure, but still adheres to the same surgical principles of attaching the esophagus to the stomach in a partial wraparound method, such as the laparoscopic toupee procedure, and the results are very similar. All those procedures I just listed result in most patients, usually 90% of patients, being able to come off of all their daily medication. These procedures are very successful at eliminating or greatly reducing regurgitation of stomach contents back up above the diaphragm into the esophagus, and all procedures allow patients to begin to enjoy food and beverages that they may not have been able to enjoy frequently in the past, and return back to normal physical activities for them, whether it be social, recreational, or occupational activities, and oftentimes results in the ability to assume sleep positions that are more natural and more comfortable for them.